Thank you all so much for joining you today. We're really excited to have you all. My name is Brittany Brinkerhoff. I'm one of the financial advisors on the team here at Hilltop, and we are just excited to welcome you all to the first webinar in our new series, Hilltop's Trail Guide to Financial Transitions. And today we are going to be talking all about Medicare, primarily covering three main topics. So we'll focus on the major mistakes that people make when enrolling in Medicare. We're going to talk about a quick overview of the supplemental plan choices and why it is so important to review and understand your options. And then we're also going to talk about how high income years can have costly repercussions. And at Hilltop, in all of our time working with clients, we've definitely seen a lot of different Medicare scenarios and issues come up. So that is why we are bringing in Bryan Gay, a Medicare expert, to talk with us today. Bryan is a leader in Medicare insurance, and he is the owner of Boomer Insurance Group. And so for over 24 years, Bryan has assisted more than 20,000 people in helping them make decisions about Medicare and other complicated insurance topics. So he definitely knows what he's doing, and we're happy to have him here today. And while we're going through today's conversation, please feel free to submit questions using the Q&A feature, and we will try to answer them all at the end, time permitting, of course. So, Bryan, to start, let's talk about some of the nightmare issues we've heard about when people enroll in Medicare. I know we see everything from enrollment delays to having to worry about gaps in coverage to having lifetime penalties, all kinds of things. Take us through it.
Perfect. All right. Well, thanks, Brittany. So let's jump right in for the enrollment delays and that kind of thing. Just enrolling into Medicare is very problematic for a lot of people. And it kind of makes me laugh because sometimes people just think it's like a light switch. They just go and turn Medicare on like it's very simple. We're dealing with the federal government here, so it doesn't really move at light speed, more like a snail's speed, right? So when you're planning to come into Medicare eventually, when you're either turning 65 or you're after age 65 coming in to Medicare after being on a group health plan or like an employer group plan, you really want to start the process kind of early. The rule of thumb is 90 days ahead of time. A lot of the mailers and people will tell their friends, you can do things 3 months before you turn 65. You could probably do a little bit ahead of time, like maybe 4 months or 5 months, or even a year. I mean, planning is always a good thing. I always tell people you can plan early or you can plan late, but it's probably better to plan early, right? So when you're enrolling into Medicare, one of the sayings I always tell people is like, darned if you do and darned if you don't, right? Because there are some people who should be applying for Medicare when they turn 65, because if they don't sign up for Medicare at 65, they're penalized for not signing up for Medicare at 65. So that's one of those darned if you don't sign up when you should. But then there's a darned if you do, right? So if you do sign up for Medicare and you should have not been signing up for Medicare, you can also get penalized for signing up when you should have not signed up for Medicare. So that's kind of odd. It's one of those darned if you do and darned if you don't. So everybody is individualized. Some people need to, some people don't need to sign up for Medicare. And this is even for people who are at the same job. Their circumstances are different. Maybe they have a spouse, maybe they don't have a spouse, maybe they're on a health savings account known as an HSA, and they'd like to keep funding that. So there's all different nuances. So I always tell people, you need to sign up for Medicare when it's right for you to sign up for Medicare. And that's always a per person, per situation. So just, obviously happy to answer those kind of questions. When we're talking about delays, like Brittany, you're talking about delays, we see that a lot too. Not only these penalties and things like that, but it's the delays. So when you're approaching 65 and you're one of those people that you need to sign up at age 65, well, people are told you can sign up for Medicare 3 months before your birth month, your actual birth month, or 3 months after your birth month. You got 7 months. So you can sign up during those months. Well, yeah, you can sign up, but nobody tells people when it's going to start. Well, if you sign up in the 3 months before your birth month, it starts on your birth month. If you sign up in your birth month, it starts the next month. And then the next month, and the next month, and the next month. So if you sign up later, you're having gaps in coverage because even though you can sign up during certain times, it doesn't start. Medicare won't start until another date in the future, like maybe the first of the next month. So we see people who come in towards that last month before their birth month, like for instance, I'm born in March, and we'll see people sign up at the end of February, and they'll go, well, I signed up in February. Yeah, but you signed up in February the 23rd. If this application goes to the government takes forever to do what they're supposed to do to then finally give you your Medicare ID card. And Medicare, just getting Medicare is the first step down that road. People still need to get supplemental plans and prescription drug plans and that kind of thing, which we'll talk about later, But it's also, you have to have your Medicare ID number before you can get your prescription drug coverage and things like that. So by delaying signing up when you should, it delays getting your Medicare ID number, which delays getting your supplemental insurances and your prescription drug insurance. So then people have delays or gaps in their insurance because they didn't sign up earlier, right? But same thing for the older people, like the people who are over the age of 65 and they're looking forward to retirement. They've been looking forward to retirement since they're in their 40s, because I'm looking forward to my retirement at some point. I'm in my 40s. But when they're just now coming off of their group health plan, like we were just talking to somebody earlier this month, right, in July, and they filled out the paperwork that they needed to fill out. They turned it into Social Security, and there was problems with their application. Well, the people at Social Security didn't help them enough to get those problems solved. So now they're delayed. I mean, tomorrow is August 1st, and they still don't have Medicare. They still don't have their Medicare ID number. They're retiring. They're losing their insurance tomorrow. And it's because they just started that process a week and a half ago. So to avoid those delays, you want to sign up ahead of time. Another real quick deal about not signing up when you should is everybody's favorite thing to talk about, which is penalties, right? So yes, there are penalties for people who don't sign up for Medicare when they should sign up for Medicare. These penalties are called late enrollment penalties. Now, we're not talking about gaps insurance and not having coverage. We're talking about straight up monthly penalties you have to pay for the rest of your life because you didn't sign up when you should have signed up. Now, these penalties you got to almost work at messing this up, Brittany. Like you got to almost purposely screw things up to get these penalties, right? So most people, I guarantee you, the people who watch these videos, your clients, like these people who are preparing, you guys don't ever worry about these penalties because people like you take the time to learn about this stuff well ahead of time that you never make any of these mistakes, right? But one of the penalties is not signing up for Part B, as in boy. We'll talk about this a little bit later, but Part B, if you don't sign up for Part B and you wait 12 months and then sign up for Part B later, and you should have signed up for it early, well, then yes, you're penalized. But Brittany, think about this. How many of your clients would ever retire, go an entire year without health insurance, the first year they're retired, like throwing caution to the wind, right? And go a whole year without insurance and then buy insurance? None of them do that.
Usually not the plan.
Right. So most people will never be penalized for Part B because they have planned ahead of time. All right. Well, then there's drug penalties. Now, these are a little more common, right? But Part D, the letter D stands for drugs. And there's a late enrollment penalty for people who did not sign up for drug plans when they should have signed up for a drug plan. Okay. Again, this is more of the penalties that we will see from time to time, but you kind of got to mess it up pretty bad again. You got to go without drug coverage from your employer or, kind of a group plan, you have to go more than 2 months. Technically, it's 63 days. So if you go more than 63 days after the age of 65 and you didn't get a drug plan or you weren't covered by drug insurance, when you buy it, you are penalized later. Again, your clients and people who work with you guys, you're so good about watching out for your clients during these milestones that just doesn't happen to your people. But you got to go 2 months without drug insurance after you retire. Most people aren't going to do that either.
Right.
Where we see people who actually get that penalty is one of two people. It's one person who says, well, I just got a 90-day prescription. I just got 90 days worth of my prescriptions. So I don't need to get a drug plan right now because I already got enough medications to last me 3 months. Well, then they wait and then they buy the plan and then their drug plan, they have to pay a little penalty for. It's not much. They might have to pay 20 or 30 cents extra a month, but it's still kind of a nuisance. But most people don't know. The real one that we see a lot of times is when people don't take any medications. Those people say, well, why am I going to buy a drug plan if I don't take any medications?
Yes.
So they just don't buy a drug plan. Now, the reason we see that happen a lot of times is because they've called one particular insurance company, right? So and I'm not picking on an insurance company, I'm just naming some names here, but let's say they called Blue Cross Blue Shield. And Blue Cross Blue Shield said, well, our Blue Cross Blue Shield Part D drug plan is $30 a month. And they go, well, I'm not buying that stupid plan. I don't need to pay $30 a month. I don't take any drugs. That's a waste of my money. I won't buy it. Well, but the people at Blue Cross Blue Shield didn't tell them anything about Humana. Well, there's a Humana drug plan that might be $5 a month. Why don't buy a plan for $5 a month? And this year for 2025, there's a drug plan in most states that's zero. Like a WellCare drug plan is $0 a month. Keep in mind, they're funded by the government a little bit. That's why they're pretty cheap. But you can buy a drug plan and pay nothing. Well, those are the plans that we would look at if people aren't taking any prescriptions. We're still going to get them a drug plan. But if they don't take any medications on a regular basis, we're still going to get them on a lower cost drug plan to save their money.
Right. Yeah. Whole point of insurance is not about what you know you'll need. It's about protecting from what you might need in the future.
Absolutely. So I would say that's kind of the main deals about these delays and enrollment problems. It's signing up initially. You got to figure out whether you should be signing up at age 65 or if you should not be signing up at age 65. The other is the delays.
Expand on that a bit. Can you talk a bit more about people who should not sign up at age 65?
Yeah, that's easy. Who's the most one for that? HSA people. That's easy. All right. So people who are working for a large corporation. Now, the government says a large corporation is basically any employer that has more than 20 full-time employees or more. Now, if somebody worked for a company that had 25 people, all 25 employees don't have to be on the health insurance at that company. They just have to have 20 or more full-time employees. All right. But a lot of people are still working for these companies that are big companies, right? Well, as long as that person is covered by an actively working employee's health insurance and they're getting the insurance through the company that they're working for, then they really don't need to sign up for Medicare, especially if they're contributing money to a health savings account. And more people are contributing money to a health savings accounts because these health savings accounts are fantastic accounts, like a type of account. You get to put the money in their tax, pre-tax. You get to take the money out tax-free. It's kind of like legal money laundering, right? You never pay tax on this money. So
yeah, we love HSAs.
They're awesome. Well, so with the HSA, the rulings with HSAs are you're only allowed to put money into a HSA, health savings account, as long as you're only covered by a really high deductible plan. But Medicare is a low deductible plan. So people will accidentally sign up for Medicare at age 65 when they should not have, because their coworker told them to, or their friend down the street told them they should, or the lady that they bumped into at the Jiffy Lube, lobby when they were getting their oil change told them they were going to go to prison if they didn't sign up for Medicare at 65. So these people, they sign up for Medicare. Well, they can't contribute any more money to those health savings account legally, but they still do on accident. So they keep putting money in these HSAs when they should not be putting money in the HSA. And then years down the line, the IRS comes back and says, hey, you were putting money into a health savings account 5 years ago, and you were not supposed to put that money in. And you got a tax deduction for putting that money in 5 years ago. So we want that tax money, because you put the money in tax-free, right? But they also want 4 years of penalties. But you also did it 4 years ago too. So you put money in 4 years ago, and we want that year of taxes plus 3 years of penalties. But you did it 3 years ago too. So we want the third year of taxes and 2 years of penalties, and 2 years ago and 1 year of penalty. Like, it's such a pain in the neck. And so if you're contributing money to a health savings account and you want to keep contributing money to the health savings account, that's perfectly fine, as long as you just don't sign up for Medicare at age 65. So that's one of those darned if you do sign up for Medicare when you should have not signed up for Medicare, you end up paying a lot of money in taxes to the IRS if you've been putting money into a health savings account, an HSA. Oh, and by the way, flexible spending accounts are perfectly fine.
Yes.
No idea why, but flexible spending accounts with Medicare, fine. Health savings account is different. So that's the darned if you do sign up and you shouldn't have.
Yeah, so many nuances when you're in that phase of working after age 65, of knowing whether or not you should sign up, whether or not you can still contribute to an HSA. That takes a lot of individual planning for sure.
Absolutely. Yeah, for sure.
Definitely. And so really the good news is that with proper planning, people can generally know the right time to sign up for Medicare. But when you sign up for Medicare, I know there are all sorts of options to pick from. So why don't you talk a little bit about what will actually be available to people when they're enrolling?
Okay, like the actual insurance plans themselves, kind of thing.
Yeah, some of those supplemental choices.
Okay, yeah. So plans. So we'll also talk real quick about things that are not available to everybody. So let's talk about that real quick. And then we'll talk about things that are available to everybody, right? So first thing is, what we won't be talking about right now are external plans that only certain people are allowed to have. I'll give you a couple examples. So for instance, some people work for the federal government, and those people have something called the FEHB, the Federal Employees Health Benefit Program. They don't even have to sign up for Medicare, by the way. But those plans are only available to people who work at the federal government. So we're not really going to talk about those plans because it just doesn't affect everybody. There's other people who retire who might have been in the military for 20 plus years or more. Well, if you put in 20 years of service into the military, you're eligible something called TRICARE for Life, which is fantastic coverage, by the way. When you hit 65, you get TRICARE for Life. Well, not everybody put in 20 years of the military either. So we won't really talk about those things. If people have questions, they can always ask about those. But what we'll really talk real quickly about are the two main options that people will have when they come into Medicare. And it's available to people who are federal retirees. The two options are also available to the military people. These next two options are available to everybody when you turn 65 or just get into Medicare, right? So the best way, and I think we're going to dive deeper into these two options later, right? Aren't we going to have another follow-up in a few months or so?
Yep. We'll plan to do a supplemental video that dives into this in greater depth, because I know it can get pretty detailed.
Absolutely. So stay tuned for a more in-depth, overview of the Medicare programs and the two main options. But just so you guys know, when you are coming into Medicare and you don't have any old group health plan as a retiree, like you've worked at the state, like a state of Virginia or state of North Carolina or state of Georgia, you're going to have the regular options that are available to everybody. And there's only two main options. So the first option is option number one is really Medicare with a Medicare supplement plan. So think of that, Medicare with a Medicare supplement. The other option is Medicare Advantage plans. So we have Medicare Advantage plans and Medicare supplement plans. Okay. Now, those languages, those terminologies really don't mean much to normal people. What's a Medicare Advantage and what's Medicare supplement? So to make it real simple, a Medicare supplement plan, it's kind of like having your own car, right? It's a silly analogy, but if you have your own car, everybody knows how a car works, right? Well, if you have a supplement plan, you just go to any doctor that you want to go to. They just have to bill Medicare. As long as they bill Medicare, you can go to whatever hospital, whatever provider, whatever doctor, and you basically are paying very little, almost nothing out of pocket when you do have surgeries or do have medical events happening. But they're more expensive. Just like having your own car is more expensive than riding the bus, right? So Medicare Advantage plans are kind of more like the bus, right? If you chose Medicare Advantage, they're wonderful plans to save money. So as a blanket statement, by the way, Medicare Advantage plans do save people money on average, but they're a little more limited. So Medicare Advantage plans are kind of like the bus. Everybody knows it's cheaper to ride the bus than have your own car. But if you go with a Medicare Advantage plan, you got to go to that network of doctors, which isn't a bad thing. But if you went on a Blue Cross Blue Shield Advantage plan, you got to go to Blue Cross and Blue Shield doctors. If you got a Humana Advantage plan, you got to go to Humana doctors. Again, it's not a bad thing, just how they work. Well, real quick about Medicare supplements. So option number one is Medicare supplemental plans. Keep in mind, Medicare supplements are also called Medigap plans. So if you guys ever hear the word Medigap, that's the nickname for Medicare supplements, which is option one. But with a Medicare supplement, like I said, it's kind of like having your own car. You're going to pay more every month for that kind of plan. You're going to pay more for a supplement, but you're easy. You can go to whatever doctors, whatever hospitals. If you need a procedure done, you just go have it done. You want to go to Duke University? Go to Duke. You want to go Johns Hopkins? Go Johns Hopkins. You go where you want. It's really designed to be convenient, but having a supplement is not really designed to save money. So that's why we always say option one, like the car, more expensive, but has a lot more freedom and flexibility. Option two, Medicare Advantage plans. Remember, they got to name everything twice. So Medicare Advantage plans are also called Part C. I don't know if the C is the right way there, but so Medicare Part C is Medicare Advantage. If you talk to doctors or hospitals, they will sometimes refer to Advantage plans as Medicare replacement plans. But how Medicare Advantage plans work is, like I mentioned, kind of like the bus. It's cheaper, but you got to go where the bus goes and you got to pay bus fares. So for instance, Medicare Advantage plans, if you go to a specialist, you're going to have to pay, let's just say $30 at a specialist. That's not bad. You pay $30, your Advantage plan pays the rest. If you go to the emergency room, you might have to pay $150 at the emergency room. Your Advantage plan pays the rest. You go to physical therapy 3 times a week for 6 weeks. You're paying a bus fare 3 times a week for 6 weeks. That's a lot of the phone calls we get, because with Advantage plans, just like the bus, is pay as you go. Well, if the physical therapy copayment is $40 and you pay $40 each time, 3 times a week for 6 weeks, that turns out to be some money, you know? but they're paying less each month for their Advantage plan. So that's the kind of the give and take about Advantage plans. You pay less monthly, but you've got to go where you're allowed to go and pay copays when you do go. So overall, it typically saves money. So that's why the quickest way I can explain Medicare for the normal Joe public is you either jump on a supplement or jump on Advantage, or you get on the car or get on the bus kind of thing.
Yeah, always good to save a little money, but having more control and flexibility can often be well worth the premium you might pay there.
Right. Yeah, for
Now,
sure.
is there any flexibility to change between the two if you make a decision and decide it might not be the right one?
Very smart question. So that's very smart. So it gets a little dicey, right? And I would say, now this is for anybody who's in a lot of other states, then this is kind of state specific for what I'm about to tell you guys next. So there's certain states that have a little more wiggle room, but the majority of states, like 43 out of 50 states, are what I'm about to tell you. So again, state by state. But when people are choosing these plans, right, when you're new to Medicare, you can choose a supplement or an Advantage plan, right? And these plans are done by insurance companies. So you can get a Humana supplement or a Humana Advantage plan. You can get a United Healthcare Advantage plan or a United Healthcare supplement. So you're getting an insurance company's supplement or Advantage plan, right? The car or the bus. Now, when you're new to Medicare, which is when you're turning 65 years old, or maybe you work past 65 and you're coming off of a group health plan, so you're leaving the group insurance and now you're diving into Medicare. Well, when you're new, both of those options are on the table. You can choose a supplement or an Advantage plan. They have to sell them to you no matter your medical conditions. You can be sick as a dog or healthy as a horse, but either way, the companies have to sell you either plan, whichever one you choose, the car or the bus, right? When you're new. Now, it gets a little dicey with the changing because if you decided to go with a Medicare supplement plan in the beginning, like the car, I said, if you go with a supplement plan, well, you can keep your Medicare supplement plan your whole life. They're fantastic plans. They're just not cheap. But they also go up in price a little bit every year. There's some people on their supplement plans that if it gets a little pricey for them and they need to save money, they can always move from the car and jump on the bus later. That's okay. So they can get on Advantage plans later if they chose to. So I'll say it again. You can go from a supplement over to Advantage plans. That's no problem. From the car to the bus, easy. Or you can start on the bus. You can start on Medicare Advantage. The only tricky part in most states, whether you get on the bus at the beginning or you jump on the bus later, whenever you find yourself on Medicare Advantage, it's almost impossible to get off of Advantage plans later. So what we tell our clients is there's nothing wrong with Advantage plans, but just so you know, once you get on Advantage, you're pretty much not going to be able to come off Advantage plans. Are there some exceptions to the rule? Yes. Yes, there are some exceptions to the rule. But the overarching rule is once you get on the bus, you're not going to come off the bus. You can change seats on the bus. That's okay, right? So if you don't like your Humana Advantage plan and want to go to United Healthcare's Advantage plan, well, we can do that. If you want to go from United Healthcare's Advantage plan to Cigna's Advantage plan, no problem. You just go to Cigna doctors and pay the Cigna copays. You're still on the bus. You just change seats on the bus, and it's almost impossible to get off the bus. Not saying it's completely impossible, but like Brittany the other day, I had a lady go, well, my sister in Colorado, she had an Advantage plan and wanted to jump on a supplement. She went and got a supplement. And I'm like, yeah, but she had a certain circumstance. And I kind of named a few of them. And she goes, oh, yeah, that happened to her. So she was able to do that. I'm like, yeah. But she was thinking I can just switch off Advantage and go to a supplement later whenever I want to. So I had to really explain that to her. I said, look, like one of our clients won a $25,000 scratch off ticket at like a lottery
Oh,
ticket at 7-Eleven.
nice.
That's about the same statistical chance. So like you have the same statistical chance of winning a $25,000 scratch off as you do getting off Medicare Advantage later. Is there a chance? Yeah, there's a chance. Is it probable? Probably not going to happen. So
Yeah.
that's the big thing is some people will start off at Advantage plans and they think they can go get a supplement plan later, and it's just not how it works most of the time. So that was a great question. Sorry for a long-winded answer for that one.
Oh, no, perfect answer. Yeah, I think that really underscores how important it is to understand the differences and what might make the most sense for you, because not always so flexible to change after you've made that decision.
Right. Yep.
Yeah, so perhaps a bit of a pivot here, but when it comes to Medicare, there are definitely the typical costs for a typical income earner. But I know we definitely work with a number of people who have higher income or go through life events like selling a business, receiving an inheritance, selling rental property, or exercising company stock awards, just things that might push up your income in a given year. Can you talk to us a bit about the income related upcharge that people will sometimes experience when on Medicare?
Oh, yes, that is fun when people get that notification letter. And yes, when you guys are working with your financial clients, man, so many advisors don't even have a clue about this income related monthly adjusted amount. And, kind of a shameless plug, but I'm very proud of you guys for doing these kind of things for your clients. I mean, I know this is not a money generating thing for you guys to have webinars and stuff about Medicare insurance. I mean, that's my company and my industry, but
Yeah.
you guys take the time to learn about this stuff and then also realize how important these things can be to your clients. So it's kind of neat that you guys invest into this kind of thing for you and your clients and just your base. But a lot of advisors have no clue about what we're about to talk about. And we get these phone calls every day. So what what she was talking about is when people make higher incomes, the government comes after those people with pitchforks and torches, basically, is they're always trying to find ways to take more money from the people who've done well financially. And if you're a higher income earner or if you sold a business, you learn that real quick, how much the government tries to take of that. Well, so this issue with Medicare and their upcharging is called the income related monthly adjusted amount. And those initials are IRMAA. If you look at those initials, it looks like a lady's name, Irma, right? IRMAA, Irma. So with Irma, it's this increase that you have to pay, right? And that's perfect timing for that question too, because this morning I was talking to one of our clients and he's retiring, and he's kind of an upper management kind of thing. And his wife is also, kind of upper income earners. So, I mean, they're not making millions of dollars a year, but they're making $395,000. So their combined household income is $395,000, which to me, that's pretty good income, as an income. Well, they're coming over to Medicare as of September 1st. So they just got a letter in the mail from the government that says you're going to have to pay more for Medicare because your income was high. Now, guys, think about this. The government doesn't have a clue how much money you're going to make this year until you file taxes later for this year. The government only knows what you've made in the previous years. So Irma, this increase, Medicare looks at the tax return you filed 2 years ago. So here we are in 2025. So this couple I just mentioned, they made $395,000 in the year 2023. He's retiring at the end of August. Well, the government, since I have their numbers here, are going to charge them $295 extra for Medicare plus $57 extra for their drug plan. So $352 a month more because of their income. And there's two of them. So that times two, that's $700 a month. They're going to have to pay more for Medicare just because they've done well financially. Now, here's what happens to most of these people. They ask their financial advisor, and the advisor's like, I don't know what that is or how that is. I guess you'll just have to pay it. Well, you guys are great because you tell your clients, no, you don't always have to pay that. So there's certain reasons you can get out of paying these increases, right? They're called life-changing events. So if you have a life-changing event, like the sale of a business or retiring or your spouse retiring, and there's a number of these little life-changing event things, death of a spouse, divorce, these kind of things. But if you have one of these qualifying life events, you can tell the government, hey, look, government, I know I made all this money a couple years ago, but I'm not going to make all this money next year, or I'm not going to make all this money this year. But here's these people, like he had just told me, he had planned on paying this IRMA increase for the next 2 years because he would have paid it had he not talked to us, kind of thing. So you take $700 a month times 24 years, or 24 months, is $16,800. So by him talking with professionals, basically, it just saved him $16,800 that he's not going to have to pay the government, because all he'll have to do is fill out a couple government forms, tell the government, hey, look, government, I just retired in August. I'm not going to make that kind of money beginning September. And they'll reduce it. They'll completely remove it, right? The government will reduce that income-related adjustment. But Brittany, he made a bunch of money in 2024. I mean, he's just now retiring, right? So last year, he still made a bunch of money. Well, this 2024 tax return is going to be affecting his 2026 Medicare rates. Well, all he has to do is fill out these forms and do the right things, which obviously you guys help your people with, and we help our people with this stuff. But you fill out the form and you tell the government, don't charge me all this extra money for 2026. Don't charge me all this extra money next year. I'm retired, or I sold my business, or my wife retired. And they will either reduce your increase, like they'll reduce the amount they're trying to steal from you, or they'll just completely remove it, right? I just think it's government stuff, but that's my own 2 cents. But I mean, we call it the extortion letter. So when people get the extortion letter, we tell them just to call us and we'll help you with it, because it really is. The government's literally taking their money and not giving them anything else in return. They don't get any additional Medicare benefits. They don't get any additional, perks. It's just literally taking their money just because they've done well financially. So it's there, but if you don't plan for it, it can be very problematic. And then, of course, kind of add one more thing, and I'll let you ask another question if you have one. But like your customers, the good news about working with good financial people is you guys give them good advice and they have more money in retirement. Well, when you guys save all these people so much money, they have a bunch of money in retirement. So there are some people who make a lot of money even when they're retired.
Right.
Those people, some of them can't get out of IRMA. They'll be hanging out with IRMA their whole life, right? But that's good and bad. It's bad they got to pay that extra fee because they've done well and they've saved money and planned ahead.
Good problem to have.
It's a good problem to have, but it's also something that you guys plan for in your financial advice. Is you say, hey, look, you're going to be making $300,000 in retirement. Like, we have saved enough and invested your money properly that you're going to make $400,000 in retirement till you're dead. Well, at that income level, you're going to have to pay more for Medicare. So then we have to carve out more of this budget for healthcare because your healthcare costs are higher in retirement just because you have a higher income. And I know you guys know that. I mean, that's what you plan for, but it's when the people who don't plan for this, they're really upset when that time comes because they didn't know to plan for it because they didn't work with a good person, a good advisor, or they just didn't do enough research on their own. So
exactly, yeah, it's not a fun surprise. And certainly I think it's key to think about those life events that might qualify for not having to pay the IRMA surcharge. But yeah, for a lot of our retired clients, especially when you're in the earlier years of retirement, maybe even before taking Social Security or before taking required distributions from retirement plans, we're often looking at things like Roth conversions. So moving money from a pre-tax account like an IRA or a 401k over to a Roth IRA that generates income for that year. But with our big picture planning that we do, we can really see, over someone's lifetime, that might reduce the total amount of income taxes paid. And so when we're doing that, we of course want to be thinking about how will IRMA be affected by any extra income that we're generating. And, sometimes that added Medicare premium is just unavoidable, and it's better to plan for it than be surprised from it. But definitely good to have that bigger picture view.
Yep. And like I said, again, you guys are really good about looking at those brackets, because when y'all's clients, call us, they said that, like, oh, we're in this bracket this year. We've taken this Roth conversion and we wanted to be in this bracket now because we didn't want to pay this extra money later. And with you guys planning that detailed, like, first off, the customers are just so much more aware, which is nice. And they're saving so much money on taxes and Medicare because planning. I mean, we're saving tens of thousands of dollars. I mean, it's not a little bit of money they're saving. So you guys are doing pretty good on that.
Thank you, Bryan. Amazing.
All right. Now, besides that, I mean, I know that's a lot. Do you have any other questions like that to ask, or I can ramble on Medicare for the next 5 days if you wanted me to?
Let's see. So those were those of the questions that I had planned for you. For all of those watching, please feel free to enter any questions you might have for Bryan in the Q&A feature of this webinar. He'd be glad to answer anything that's top of mind for any of you. But while people are perhaps submitting questions, I know something I'm curious about. I mean, Bryan, you work with so many people on a daily basis. I'm curious if there's a really most common issue that people come to you with. Is there something that could be really easily avoided?
Yeah, I mean, I'd say that the most easily avoidable thing is really those delays, like we kind of started the whole thing with. It's really when we see people who just aren't turning in the right paperwork at the right period of time. Like I'll give you an example. Is we have another guy, this is like yesterday basically, but he turned in his papers to Social Security and they didn't let him when he turned them in. He didn't outright. They don't really look at him when you're turning them in. Well, his application has been pending for 2 months. And every time he's called in, Social Security, it's still pending. We're still processing it. Days to process these papers. So just wait around. It'll get done. We're going to do it. Just hold your horses. It ain't going to get done. He was missing key points of a couple of those little line items on that form. It ain't ever going to be done. He was never going to get Medicare, but now he's starting to panic, right? Towards the end of the month. And I said, well, did you turn in those forms? He goes, yeah. I'm like, well, do you have a copy of them? So he gave us a copy of them. I'm like, well, you're missing this one here, and that date's not exactly the way it should be in there. So you can call Social Security for the next weeks, and they're still going to say the same thing. It's pending. It's pending. It's pending because it's not accurate. So that was an easy fix. Like we just told them, hey, fix this and this, and go back to the Social Security office and turn it in as corrected. Well, we did, and everything's fine. But that's part being just frustrated with dealing with the government is they kind of blow you off a lot of times. It's pending. It's pending. It's pending. Yeah, it's pending, but why pending? is there something missing? So I'd say that's one of the major things, and it's very, very anxiety producing for people who are, especially people who are retiring maybe because of health challenges. So now they're retiring because they're not as healthy as they need to be, and they're going to get medical care, and they're about to have no insurance because Medicare is delaying enrollment. So, like you said earlier, proper planning is very important.
Definitely a risk there. All right, we've got a couple questions here, Bryan. So first one here is, can you share more about the basic care Part D?
Yeah. So Medicare Part D, letter D stands for drugs, right? So the best way I can kind of explain what a lot of people understand is Part D is a government program administered by companies. So you don't just get a Medicare drug plan, you get a Humana Part D drug plan, or a WellCare Part D drug plan, or United Healthcare Part D drug plan, right? It's kind of like the affordable, the Affordable Care Act called Obamacare, right? Well, nobody walks around with a plastic ID card with Barack Obama's face on it saying, I have Obamacare. Affordable Care Act plans is a government program, but it's by insurance companies. So you get a Blue Cross and Blue Shield Affordable Care Act plan or a United Healthcare Affordable Care Act plan, right? So they work the same way. Obamacare, government program administered by insurance companies. Plans is a government program administered by companies. So, and I'll give you a quick analogy. In North Carolina, there's 14 available drug plans. Okay, so they're all going to work the same. Mechanically, they're going to work the same. It's health insurance, it's drug coverage. So for people who've been taking prescription, the overarching easy thing to say is you have an ID card, you take that ID card, and you pay for that ID card. Like you pay for your insurance. You take that insurance ID card to the pharmacy, and before the pharmacy hands you your prescriptions, you got to give them some money because what you give them is called your copay, right? So copay, you pay some for your drugs, and your insurance company is paying the rest. Well, different drugs have different copayments. So for instance, like if I take cholesterol medication, well, if I take ones that I can't pronounce, those are usually generic, right? So like atorvastatin or rosuvastatin, generic prescriptions are cheaper. They usually work just as good as the name brand drug, but they're cheaper. So my copay at the pharmacy, the money I got to give the pharmacy is lower for generic drugs. Now, if I take the name brand, like Crestor or Zetia or Lipitor, well, those are a lot more expensive because they're name brand drugs. So my copay is going to be a lot higher at the pharmacy. So you want to make sure the plan that you get covers the drugs that you take also. We see that happen a lot. Brittany, one of my favorite things is we had a lady a couple weeks ago. She called me and she goes, "Do you know Medicare doesn't cover inhalers?" Who told her that? But nobody told her that. But here's what happened. She planned through an insurance company, and then when she went to go use that plan, it another drug that does that same thing that's covered by. There's a lot of workarounds around that. And people start paying a lot of money for prescriptions. And guys, it doesn't really matter to a lot of people who are healthy. They don't even realize these things because when you're healthy, it doesn't affect you. But when you start getting sick or start having medical challenges later, and you start taking more and more and more prescriptions, they start costing more and more money because you're buying more and more medications. Well, there's a limit. It's called your out-of-pocket maximum. So if you have paid $2,000 this year, and remember this year is 2025 in case this is seen next year or after, but in 2025 the out-of-pocket maximum for Medicare's drug program is $2,000. So if I went to CVS, I'm not going to pay more than $2,000 for my covered drugs the rest of the year. So if I paid out $2,000, I still get to pick up my prescription. I just won't have to pay anything at CVS for those prescriptions the rest of the year because my insurance company is going to come in and pay the rest, the whole cost of my drugs the rest of the year. But they have to be covered drugs by your plan. So that's a key thing there. So hopefully that answered that person's question.
Yes, yes. Great cover. Question. Wrapping up here. Next one is, my pension includes Blue Cross Blue Shield for life, and they say it becomes the supplemental with Medicare. What does that look like?
That's a personal thing. So we see that quite a bit. Like most of our clientele are in like the East Coast, like Virginia, North, South Carolina, Georgia, that kind of thing. But just talking with from Pennsylvania last week, well, they have HOPS, Blue Cross and Blue Shield from Pennsylvania, kind of thing. And you got to be careful because even these retiree companies, they will use the wrong words, right? Now, I was raised by a school teacher, which I know doesn't add up because my grammar is terrible. But she always tell us words matter. Well, words do matter, right? So there's a lot of, like this Pennsylvania state. So the state of Pennsylvania, in all their literature, it says retiree Medicare supplement, Blue Cross Blue Shield Medicare supplement for state retirees. Brittany, it wasn't even a Medicare supplement. Medicare supplements are a type of insurance, just like Medicare Advantage is a type of insurance. So that's where the language gets a little confusing. So even the people in Pennsylvania, they're not getting a Medicare supplement. What they're really getting is a secondary plan. So it's called a co-insurance secondary plan. So whoever asked that question, you want to make sure, is your employer offering you an actual Medicare supplement? Because if it's a supplement, it's going to be done by a lettered plan. I'll give you an example. Like it would be called a Medicare Supplement Plan G, or a Medicare Supplement Plan F, or a Medicare Supplement Plan N. Supplements are done by letters. Plan F, Plan G, Plan K, Plan J. So if you're looking at your documentation from your employer, if it doesn't say Medicare Supplement Plan G or Medicare Supplement Plan N, it's not a Medicare supplement. It's just a secondary plan paying after Medicare pays. So just read the fine print and make sure you know what you're doing. Because like I'll give you an example, the state of Virginia, if you retire from the state of Virginia, their plan's a good plan, but it's a horrible price. So nobody who's good at math stays on the Virginia retiree health plan. But the state of North Carolina gives a really decent Humana plan. So a lot of the state people who retire from North Carolina, that's a pretty good Humana plan. So it's all who you're getting it through, what plan are they offering, and that kind of thing. So again, that's kind of a personal issue of what you may or may not want to take, but you are still allowed to go out into the open marketplace and choose either a Medicare supplement or a Medicare Advantage. You just have that third option, which is from your employer.
Nice to have options. And yeah, for some of these kind of individual scenario questions, I'd highly encourage anyone to reach out to Bryan and Boomer Insurance because they can be an amazing resource for these kinds of questions, which our third and final question is probably a similar answer. So we have someone who is 74, still working full-time at a university, signed up for Medicare Part A at age 65, has a Medicare number, but is on employer's health plan, retiring next year. So the question really is, when should I add other parts of Medicare and what should I be cautious about?
Perfect question. And that's one of the exact people we were talking about earlier with these paperwork delays. So please start the process about learning what plans are available in your area no less than 3 months ahead of time. But you can't ever plan too early. You can plan too late, but you really can't plan too early. So like if you were going to be retiring at the end of next year, for instance, I would probably tell you to start looking at, what you'll need to do and when you'll need to do it in January or February or March, because for that, when you're leaving a group health plan after the age of 65, just to start with, you're going to need 2 separate government forms. The first form is a form that your employer is going to need to fill out, and your employer fills it out, gives it back to you. The other form that you're going to need, you fill out yourself. So then you have these 2 forms, and you got to take those 2 sheets of paper, those 2 forms, down to your Social Security office and turn in those forms. And if those forms are not in good order, you're going to hear the word pending a lot when you start calling in. So just, like, again, we help all of our customers with these kind of forms because we want everything to go smooth. But you're going to want to plan that process at least 3 months ahead of time. I would tell you, start looking at it 4, 5, or 6 months ahead of time just to get a foundation of what's available in your area.
Love it. Yep. Great to be ahead of the curve. So yeah, we're almost right at 1 o'clock here, so we can wrap things up. And really, I know we've talked a good bit about Medicare on a high level today, but it's definitely a deeper and more nuanced conversation for each individual person. So again, I encourage you all to reach out to Bryan if you have any questions about your individual scenario. Boomer Insurance is always happy to help, but if you aren't working with Hilltop yet as well, and you want to think about how Medicare planning could fit into your bigger holistic financial plan, and that's really where we love to help. We will be sending out a recording of this webinar, so feel free to rewatch or share it with family or friends. But yeah, thank you all so much for joining us today. We'll have our second webinar end of August on downsizing in retirement. We look forward to seeing you there. Thank you all so much.
Bye.